Good morning, everybody. Once again, I'm back with age estimation. In this class, we will learn more about suture closure and examination of X-rays. Uh, Last class, we have learned about the importance of age. We'll have a recap of that at the end of this class. So now coming into cranial sutures. Before going to the cranial sutures, uh, at birth we have about 450 centers. In the 11th week we have about 806 centers, and in the adult skeleton we have only 206 bones. So uh, 850 to 450, 806 to 450 to 206. The loss of 600 bones, where have they gone? It's nothing but fusion of these fragments of bones to form a bone, a whole structure of one particular bone. So by the fusion of these bones itself is by the fusion of these gives us an idea at what age each of the bone and gets fused, and that's how we estimate age. So there are many parameters, like if you have definitely an age certificate or I mean birth certificate, uh, wherein the child is where the child is born, when he is born. When he is born, a person will have an idea about his age based on this, based on his time of birth, year of birth, day of birth, and month of birth. But in cases where there is no idea of when he was born, in such cases uh, we can only estimate that person's age by the fusion of bones, teeth, sexual characters, as I have secondary sexual characters development, and other things which I have enumerated in the previous class. So now coming into the cranial sutures, we have like sagittal. We have mainly sagittal, coronal, and lambdoid sutures, and one such suture, that is a metopic suture in between two frontal bones, which is usually closes by 2 to 4 years, and anterior fontanelle, as I've told you, closes between 1.5 to 2 years, and the posterior closes by 6 to 8 months. The rest of the sutures will be closing as you go down the skull. The age of the if the sutures are closed, the age is more. In the center or at the vault, uh, the sutures fuse a little bit earlier. Now coming into the Frederick rating or scale for sutural fusion, usually they fuse uh, uh, inner table fuses first when compared to the outer table. So the fusion of the inner table is nothing but endocranial suture closure, whereas outer table closure is nothing but ectocranial suture closure. So this is graded in 5 grades. When it is open with a gap, then it is a grade 0, and if it is less than 50% is closed, it is grade 1. Less than more than 50% closed, then it is grade 2, and if it 3/4 or more of 50% is closed, then it is grade 3, and 4 means totally closed. No, you will not be able to find the visible suture line. And this is a little bit of easier parameter. When you look at the skull and skeletal remains, we get in in many of the cases we get a bundle of bones, like we get in sometimes a person is buried somewhere, or it comes to a recently we had a case where then the person was found dead, and many groups of bones were entangled in a fishing net which is found in the banks of a lake. We went to the scene and found that the water due to the summer, the water has dried up, and these bones which are underwater might have surfaced because of drying of the lake. So there we picked up all the bones, brought to our college, and we placed them on the table. You must have seen us doing something in the corridor of our department. On the table we have placed it in anatomical position, and we found out the age, the sex, and various other parameters, whether it is whether the bones are only human or mm, or animal bones, or we had to find out it is male or a female. So based on the we can estimate the stature of the person, how much height he is, based on these various parameters. Because of sometimes if we get such a case, how to deal with it is the big question mark for us. So for at such a condition, to estimate the age and to what do you say, uh, to come to a conclusion, some of the parameters which help us are this suture closure. So now coming into again, for us in a colloquial language, the stage 0 means the sutures are open. There is still a little space left between edges of adjoining bones. In stage 1, incipient closure is there. Clearly visible is a continuous, often zigzagging line, which we will give you in the next slides. You will be able to make out. Then stage 2 is nothing but closure, which is in the process. The line becomes a little bit thinner, and there is less of zigzagging, and it is interruptions are a little bit less and are complete, and there is a complete closure. And in stage 3 we find it is closed. Closure is an advanced stage. Only pits are there, and suture is located almost, we find it is totally closed. Then stage 4, it is totally closed. Even location of the suture line cannot be made out or recognized. So here this is stage 0. This is the ectocranially on the left side, you can see, whereas endocranially there is a little bit of gap which shows that it is not closed. So it is stage 0. Now in stage 1 we can see this. A little bit of closure, 50%, less than 50% of the suture line is closed. In stage 2 more than 50%, and zigzagging a little bit is less. And whereas in stage 3 there is in stage 3 there is a little bit of pitting is there, and the suture line is faded. See, you can appreciate here stage 1, 2 and 3, both all the 3 stages you will be able to appreciate. And stage 4, you have seen that you cannot make out any suture line. So this is how you make out or estimate the age. This is about the closure of the skull sutures. And one more important thing is, in males the suture closure is a little bit earlier when compared to the females, whereas in the what do you say, ossification, fusion of the long bones, in case of fusion of the long bones, the females in females it fuses earlier in long bones when compared to the males. This is a fusion of this is the breastbone or the sternum. Here we can estimate the age by these appear in months. So how it is made up of manubrium, as you know, and 4 pieces of the body, and the small piece called xiphoid. So to which are attached the costal cartilages of ribs on both the sides. So this is what you see, and each one has a center. each one has a center. So uh, the fusion of these bones starts from age of 40, wherein the xiphoid with the last piece of sternum fuses at the age of 40 years, and the manubrium and the first piece of body fuses at the age of 60 years, 50 to 60 years. So the rest of it is fused between the from below upwards, it is 15, 20 and 25 years. The fusion between the fourth and third is 15 years, the third and second is 20 years, and second and third is 25 years. So this is how this is seen in an oblique view, where you can appreciate the fusion of these on the sternum, the pieces of the body of sternum. Based on this, you will be able to come to a conclusion about the age between 15 to 40 years, yeah, and above. So here it is a diagrammatic representation. As I told you, xiphisternum and last piece fuses by 40 years, whereas manubrium and first piece of body of sternum fuses at 60 years. The rest 15, 20 and 25 years. This is for your ease. So this is a small chart which we have prepared from the textbooks, and to make it easy for us to know the fusion of the various centers. If you go through, it is very easy, and if you memorize it, it is useful for you lifelong. So these are in an X-ray, these are the centers we can see. Here we see the head of the femur. This is an X-ray of hip bone, where you can see only the head of the femur, and there is a you can also see greater trochanter, and triradiate cartilage is not obliterated. This is between the ages of 1 to 4. We'll come back again. We'll learn about each age group, in each age group, how an X-ray looks. So this is at the age of 2 months, a child will have no, a baby will not have any carpal bones. So at that time it looks like this. And this is a baby of 3 years. So you just remember the number of carpal bones plus 1 gives you the age of the baby. So there are 2 carpal bones, and the third one is just appearing, you can see, and the age is about 3 years. So you can see that there are 2 carpal bones. You can see the lower ends of radius and ulna, and you have the metacarpals first and the other 4. Then you have the phalanges. So how do you recognize uh, uh, the thumb and the other fingers? The thumb has only 2 phalanges, the rest of the fingers have 3 phalanges. So you can make out and see how it looks. Here, how many are there? There are about how many carpal bones? There are about 6 carpal bones, and so the age is about 7 to 9 years. And you can also see the appearance of heads of other metacarpals and base of the first metacarpal. So this is the base of the first metacarpal below the 2 phalanges of the thumb, and the heads of other metacarpals are present below the phalanges of the other fingers. And this child's X-ray is about, gives us an idea of the 7 to 9 years. In this X-ray, it is again a X-ray of hip bone. Here we find a triradiate cartilage has not obliterated. It is not continuous arch-like. What is triradiate cartilage? It is triradiate cartilage is nothing but uh, acetabulum, which is formed by three bones. So only it is called as triradiate cartilage. What are the three bones? It is nothing but ilium, ischium, and pubis. You can see the centers for head, greater trochanter, and lesser trochanter, but which are not fused to each other. So the age of this person's this thing as per the X-ray is 8 to 12 years. Here it is a lateral view of the elbow joint. You see the radius, the lower end of humerus and ulna. And this is the olecranon at the lower end at an angle, and the head of radius. The centers are there but which are not fused. So the age becomes 11 to 14 years. Now coming into the X-ray of shoulder joint. Here we can see the center of acromion has not appeared. Coracoid process has appeared and it is almost getting fused, but it's not complete. Whereas conjoint epiphysis is formed but not united with the upper end of humerus. Here, how is the conjoint epiphysis formed? It is formed by the fusion of greater and lesser tubercle with the head of the humerus. So as per this, the person is about 11 to 15 years. Again, once more, we are having a view of X-ray of hip joint. The triradiate cartilage is not obliterated. We find head of femur, greater and lesser trochanters have appeared and they are not fused. This is another same. These are the centers. Triradiate not obliterated. Head of the head, greater and lesser trochanters have appeared but not fused. And there we can see a slight appearance of iliac crest on the top, on the picture on the right side of the picture. Now coming into the second, it is the X-ray of elbow joint, AP view. Here we see the lower ends of humerus, upper end of ulna and radius. The centers for a head of radius, medial and lateral epicondyle have appeared but not fused. So the age is about 14 to 16. Now coming into the another X-ray of hip joint. Previously we have seen about the triradiate cartilage. We have seen about iliac crest. Now we are seeing the ischial tuberosity. So this is how it looks if it has appeared but not fused. The age could be 16 to 21 years. So this is the proforma which you have to write during the exam. Given the X-rays of usually we take X-rays of lateral view of skull, and we take X-ray of right shoulder joint AP view. We take X-ray of elbow joint, wrist joint, all AP views, and we take X-rays of pelvis AP view. So what are the centers? This is how you write in the exam. Ossification, you name the X-ray, write the centers, and in the observation column whether they have fused or not, and in the inference column based on the fusion what is the age group. Finally at the end you come to a conclusion. So this is how you have to put a tabular form in your exams. So what are the X-rays, what are the centers you look for in a case of a X-ray skull lateral view? In young less than 25 years you go for a lateral view of skull. If more than 25 you go for lateral as well as anteroposterior view for viewing the sutures. Now coming into the X-rays which we give, usually we get cases below the age of 25 years. So So for this we look for only skull X-ray, shoulder, elbow, wrist and pelvis. And for better view of the teeth, we take orthopentogram, so which I will show you in the later X-rays. So what are the centers we look for? The crowns of third molars. In a skull X-ray, we look for crowns of third molars, whether they have erupted or not, whether they are present in all quadrants or not, or the crowns are present in the gums. And then we look for roots of second molars which are calcified or incompletely calcified. So if they are present, the age is between so and so. If they have erupted, it is above, it is 17 to 25 years. If it have if the roots of second molars have completed their calcification, it is 17 years. Now coming into the X-ray shoulder joint, there are mainly three centers: center for acromion, center for coracoid process and conjoint epiphysis. As I told you, conjoint epiphysis is nothing but like triradiate cartilage. This conjoint epiphysis is formed by fusion of greater and lesser tubercle and head of humerus. So center of acromion has appeared. It appears at the age of 13 to 14 years. If it is fused, you have to write in the same in the observation column. If it has appeared, it is 13 to 14 years, and if it has fused, it is 15 to 16 years. When coming into the coracoid process, if it has fused, it is 10 to 11 years. If appeared, if it has fused, it means 14 years. When coming into conjoint epiphysis, if it has formed, it is 5 to 7 years, and fusion completed by 18 to 19 years. Now coming into the elbow joint, we have mainly head of radius, medial and lateral epicondyles of the lower end of humerus, then olecranon of ulna, which is viewed only in the lateral view. So coming into medial and lateral epicondyles, whether these centers have appeared. If appeared, they have fused or not, you have to write in your observation column. So based on that, the age is also given. So appearance of medial epicondyle is at the age of 5 to 7 years and fusion 15 to 16. Lateral appears at 10 to 11 years and fusion is at the age of 15 to 16 years. And head of radius appears by 5 to 7 years and fusion is over by 14 to 16 years. Now coming into olecranon of ulna, it appears 8 to 10 years and fusion is complete by 14 to 15 years. So on the whole, all the centers at an elbow joint is complete by the age of 16 years, whereas in case of a shoulder joint, they are complete by the age of 18 years. Now coming into the X-ray wrist AP view, we see the following centers. First, the carpal bones. How many carpal bones are there? There are about 8. So the appearance of the proximal row and the distal row based on the mnemonic, she looks too pretty, try to catch her. It is given in the previous chart also, you can see. So the last to appear, the carpal bone which appears last is the pisiform. If it has appeared, it means it is 10 to 12 years. So it is understood. Until that, if there is one carpal bone, the person's age is about 2 years. So number of carpal bones plus 1 gives the age of that person. Whereas if the person is having 8 carpal bones, it means the age of that person is about 9 years. You are 10 to 12 years and beyond. So how many carpal bones will an adult have? You should know by now. Then base of the first metacarpal appears by the age of 3 years and it fuses by the age of 15 to 16. And heads of other metacarpals I have showed you previously in the previous X-rays how they look. They appears at the age of 3 years and fusion 15 to 16. Then lower ends of radius and ulna, they appear at the age of 1 and 5 years respectively, and they fuse at the age of 17 to 18 years and 17 years respectively. So the uh, the last to appear is lower end of ulna, but it fuses earlier when compared to radius. Now coming into X-ray pelvis AP view, we have the following centers. One is triradiate cartilage. As I told you, it is formed by the fusion of ilium, ischium and pubis, and which form an acetabulum, otherwise called as triradiate cartilage. Since three bones unite, it is called triradiate. They appear in a form of a radiating pattern, so it is called triradiate cartilage. So if it is obliterated, it means the person's age is 13 to 15 years, and the other centers are iliac crest and ischial tuberosity. Iliac crest, on the top. Ischial tuberosity is the bottom of the hip bone from the this thing. Then the other when compared. Now coming into the femur, centers for femur, head of femur, greater and lesser trochanters are the three centers. They unite with the upper end of femur at the ages of 1, 5, 5 and 10 years, but they unite by the age of the head fuses appears at 1 year and fuses at 13 to 14, whereas greater trochanter appears by 5 to 7 years and fuses by 15 to 17. Lesser trochanter appears later at 10 to 11 years and fuses by 15 to 17 years. Ischiopubic ramus is obliterated or fused at the age of 6 to 8 years. So this ischiopubic ramus is the first one to obliterate. Now coming into the report, this is how it looks. This is how we give the age estimation report, which we give appears like this. So at the age of 4 years, here you can see the center of acromion has not appeared. There is coracoid has appeared. The head of conjoint epiphysis is still forming but not fused with the upper end of humerus in this particular X-ray of shoulder joint. Now coming into the elbow joint, you can see the head of radius appeared but not fused. Other centers have not appeared. Now coming into the wrist joint, you can see lower ends of radius and ulna have appeared but not fused. Base of first metacarpal has appeared, heads of other metacarpals have appeared, and carpal bones are there. And now coming into the hip bone, you cannot see, and there is no iliac crest or ischial tuberosity, but we find ischiopubic ramus is there. The triradiate cartilage is not obliterated. I have put an arrow, you can see on the left side. And head of radius, head of femur has appeared but not fused. So this is how we write the report. This is based on these findings. This particular person's age is about 4 years. Now coming into 4 to 5 years, all the changes are same, and you can see how many carpal bones there are. This is just another sample of the same age group, 4 to 5 years. And now coming into 6 years, the same we can see, but here there is coracoid process is there. Head of radius is appeared but not fused. Then conjoint epiphysis has formed but not fused. Acromion is just appearing. Then we find head of radius is there. Other centers are just appearing. Here we find lower ends of radius and ulna and carpal bones. We find heads of other metacarpals and base of first metacarpal. All have appeared but not fused. Similarly, in the hip bone, we find the same triradiate has not obliterated. Ischiopubic ramus has also not fused because it fuses at only 6 to 8 years. Here it is not fused. You can see a small gap here. And head and greater trochanthus have appeared but not fused. Triradiate is not obliterated. So this is the findings. So here this is an X-ray at the age of 7 years, how it looks. These are the various centers. So as I told you, there is mixed dentition from 6 to 12 years. So here you can see, you can easily make out which are the temporary tooth and which are permanent. So this is the orthopentogram, which gives us a better view regarding the uh, X-ray regarding the teeth. Now you see so many. See, there are so many crowns of third molar seen. Then canine, you can see premolars. So these are all primary teeth are seen. Their roots you can appreciate how they are looking. So the findings are same. Acromion has not yet appeared. Coracoid has appeared. Then the conjoint epiphysis has not fused with the upper end of humerus. Similarly, triradiate cartilage has not obliterated. Head, greater and lesser trochanthus are appearing but not fused. We can see the ischiopubic ramus recently fusing. Then you can see here, this is a lateral view of elbow joint. You can see the ulna, the radius, their centers, but not fused. Here lower ends of radius and ulna appear but not fused. You find various, how many? There are about six carpal bones. You can see the base of the first metacarpal and heads of other metacarpals. You just try to appreciate so that you can sink in with the particular ages what are the changes you can see. And next time when you see an X-ray, you should be able to appreciate what are the centers, what are you are looking for, whether they have fused or not, and based on that their particular ages. Similarly, at the age of 7 to 8 years, this is the how it looks. This is the orthopentogram. You can see the crown of third molar. This is at the age of 9 to 10 years. Here also you can see mixed dentition in the orthopentogram. You can see the centers, how they are slightly obliterating. In the hip bone, triradiate cartilage, you can appreciate it. There is still no iliac crest or ischial tuberosity. Greater and lesser trochanthus are started fusing. And now coming into the shoulder joint, acromion is still not about to appear. Coracoid is appearing. Conjoint epiphysis has formed, and the gap is narrowed between the conjoint epiphysis and the upper end of humerus. Similarly, in the elbow joint, centers have appeared but not fused. And here in the wrist joint, we find the carpal bones, lower ends of radius and ulna, and the metacarpals, their heads and bases. Based on these findings, you can give it as 9 to 10 years. And here you can see all the 8 carpal bones. Now coming into this X-ray, here we find almost mixed dentition is getting over, and crowns of third molar is seen in the orthopentogram. And in the shoulder joint you can see uh, conjoint epiphysis is there, and the coracoid process is slowly disappear, means getting fused, and acromion is appearing. Here all the centers around the elbow joint have appeared but not fused. Here all the centers in the wrist joint have appeared, still not fused. All the carpal bones have formed. Heads of other metacarpals and lower ends of and base of the first metacarpal have appeared but not fused. Here you can see still there is no iliac crest or ischial tuberosity. Head, greater and lesser trochanters have appeared, and still the triradiate cartilage has not obliterated. In the next, in this almost mixed dentition is over, and almost all the teeth are permanent. There you don't find any other tooth in the gums, crowns present in the gums, except for the third molar seen within the gums. The roots of the second molar not calcified. Now coming into the shoulder, acromion has formed, appeared. Conjoint epiphysis formed but not fused, and coracoid has is fusing almost complete. Then elbow joint, we find all the centers around the elbow joint have appeared, but head of radius is fused. Medial and lateral epicondyles have appeared but not fused. Here you find lower ends of radius and ulna have appeared but not fused. Carpal bones, all of them have appeared, and heads of other metacarpals and base of base of the first metacarpal has appeared but not fused. Here triradiate is almost getting obliterated. Head, greater and lesser trochanters have appeared and in the process of fusion but not complete. Iliac crest and ischial tuberosity have not appeared still. This is how the report is. The same, all this orthopentagram remains the same, with the crowns of third molar seen within the gums and roots of second molar not calcified. The shoulder joints, here you can see the acromion appeared but not fused. Coracoid has appeared and almost fusion is getting complete. Conjoint epiphysis is appeared and fusing, started to fuse with the upper end of humerus. Elbow joint, we find all the centers around elbow joint have appeared and in the process of fusion. Lower ends of radius and ulna have appeared but not fused. All the carpal bones have appeared. Where is the pisiform? Pisiform also has appeared and it is clearly visualized. Base of the first metacarpal and heads of other metacarpals have appeared and started fusing but not complete. Now coming into the hip X-ray of hip bone, you can there is no iliac crest, no ischial tuberosity, triradiate cartilage recently obliterated. You can see the greater trochanter, lesser trochanter and head almost getting fused. So the age is 12 to 13 years. Now coming here, 13 to 14 years, see the acromion how it is. Coracoid has fused. There is a small gap for conjoint epiphysis and humerus, but its fusion is complete only at 18 years. Now coming into the centers around elbow joint, medial and lateral epicondyle and head of radius shows recent. Medial epicondyle has not fused yet, the rest of them in the process of fusion. Here lower ends of, in the wrist joint, lower ends of radius and ulna have appeared but not fused. All the carpal bones are there, and the base of the first metacarpal and heads of other metacarpals have not fused. In the hip bone, triradiate is almost complete. Triradiate cartilage has almost obliterated. The head, greater and lesser trochanters have appeared but not fused. Iliac crest and ischial tuberosity have not yet appeared. So this is how the report looks, and the person's age could be, the child's age is about 13. Years. So here the acromion has appeared in this X-ray of shoulder joint. Here acromion has appeared, coracoid process has appeared and fused. The conjoint epiphysis all getting fused. All the centers around elbow joint have appeared and fused, except for the medial epicondyle, which is recently fused. Lower ends of radius and ulna have appeared, and they are they are fusing but not complete. Then all the carpal bones are there, including the pisiform. Base of the first metacarpal and heads of other metacarpals have appeared and fused. And the hip bone, you can see the triradiate cartilage has obliterated. Head and greater trochanters have fused with the upper end of femur recently. Iliac crest and ischial tuberosity have just started appearing. 17 to 18 years, you can see still the orthopentogram remains the same, with the roots of second molar not calcified and crowns of third molar seen still within the gums. And here in the shoulder joint, you can see fusion is complete. Acromion has almost fused. Coracoid is also fused, and all the centers around the elbow joint have fused. Lower ends of radius and ulna have fused. All the carpal bones appeared. Base of the first metacarpal and heads of other metacarpals have fused. Here, then the iliac crest has appeared. You can see a white line on the top, and ischial tuberosity has appeared, but not fused. Head and greater and lesser trochanters have appeared and fused. Triradiate has obliterated. So here we can see there is a little bit of variation here, wherein the roots of second molar has uh, calcified, but the third molar is present at an angle, and it could not be erupted because of the obstruction of the second molar, and it is at an angle. So because of the it is grown in the, there is no space for it to erupt because of the jawbone. So you can say that third molar is an impacted tooth. That means this person will not be having wisdom tooth in the lower jaw. Upper jaw, it is trying to find some space. Here you can see acromion fused, coracoid fused, conjoint epiphysis fused, everything is done. All the centers around the shoulder joint are totally fused, it means that he is 18 to 19 years. Similarly, around elbow joint all fused, all around the wrist joint also fused. Hip bone, you can see iliac crest, ischial tuberosity is there, head, greater and lesser trochanter, triradiate, all have triradiate has obliterated, the rest is fused. 19 to 20 years, this is how it looks. There's nothing different about it. You can see how everything has fused. Twenty to 21, same, still the crowns are within the gums of the third molar. Crowns of third molar seen within the gums. Roots of second molar not calcifying. All the centers around the shoulder joint have appeared and fused with their respective bones. You can see the iliac crest fusing, ischial tuberosity also getting fused. Triradiate and the rest of it have fused. So here you can see the chest X-ray lateral view. Based on the fusion of the second and third pieces of the body of sternum, you will be able to make out the age of that person. So the rest of the centers have fused totally with their respective bones in their respective X-rays. You can appreciate it. This is at the age of 30 to 35 years. You can see the sternum. It is not so clear, but okay. Here you can see a small dip in the suture line of the anterior view. That means it shows that ectocranial sutures are not fused. So is the case with this X-ray, but it is not so clear. You cannot appreciate much of the sternum. But the ectocranial sutures have not fused. You can see a small dip in the um, at the vault in the outer table. So based on that, it is the age is about 30 to 35 to 40 years. Here also the same thing, 40 to 45 years. Ectocranial sutures are not fused. Endocranial fusion is seen. Here we can see probably this person has undergone CABG, due to which there is wiring, you can see. The lower part xiphoid and xiphoid, the base of the sternum and body has fused. You can see that. And then next you can see the same. Here everything is fused. You can see the manubrium as well as the body of sternum of the first piece of the body of sternum has fused. So you can straight away give it as 50 to 60 years. Always after 35 years, after 25 years, you have to give it in a range of 5 to 10 years, because you cannot pinpoint a particular age after that. So this is also one more. Here you can see some are fused, some are not, but the shadows of the ribs are a little bit um, hampering the view. Still you can appreciate the manubrosternum with the body of which is fused. Here there is no dip except for a slight in the middle on top. Outer table is not fused. inner table is totally completely formed. This is at the age of 60 to 70. You can see, appreciate the sternum and the sutures. Now coming into the recap of here you have to previously, as I said, you have to give your what x-rays, their centers, and then the ossification centers, and the next column, in the observation column, whether have appeared fused or in which stage they are, and based on their fusion stage of fusion, you have to give the inference column. So after coming to a conclusion of one particular age, you give that person's age as so and so. So that important of that particular age we are going to see now. That is the medical legal importance of each age. So this is a simple recap for you to give a it is gist of previous class. So as you know, at less than 2 weeks fertilization, it is an ovular period. At 3 weeks, 3 to 8 weeks, it is called an embryo. From 9 weeks to term, it is fetus or feticide. If it is 12 weeks or 3 lunar months, it means MTP Act. That is, with one doctor, a person can terminate the pregnancy. At the end of 5 lunar months, with the help of 2 doctors. Now it has changed to 24 weeks. So a person, 2 doctors, with the help of 2 doctors, a person can they can terminate the pregnancy. Then at 28 weeks, it is stillborn fetus, considered as stillborn fetus. Before that, in the 16th week or the end of the 4th month, the baby, if the baby is quick, the punishments will keep on changing based on that. Then comes the 7th month or 210 days. It is the viability, where the baby can lead a life without even if separated from the mother independently. Then at birth or 10 lunar months, it is a full term fetus. So any death of that fetus illegally means it is infanticide or feticide, and it is considered as murder, and the punishment is equal as per the section 302. Now coming into the afterbirth, until 28 days after birth, the baby is considered as a neonate. Until 1 year, the baby is called an infant. So infanticide or murder, killing of the baby is nothing but infanticide and can be treated as a murder, and punishment is also awarded as per the law. Then 5 years, child is punishable for the acts done, illegal acts done by the child, knowingly or unknowingly, as per the Indian Railways Act, whereas at 7 years, an act done by the child below 7 years is not an offence as per 82 IPC. 7 to 12 years, child may or may not be responsible for acting independent on ability to understand the nature and consequences of the act as per 83. 10 years, child is removed from the legal guardian for the purpose of robbing property or anything. It is considered as kidnapping and is dealt with in section 369, as I referred before. At 12 years, the child cannot give valid consent for any harm that can be done, any operative procedures, but he can give a consent for simple examination. At the age of 14 years, he cannot be employed as per the Indian Factories Act. 14 to 15 years, he can be employed, but with a fitness certificate. When at the age of 15 years, definitely he can have sex with his own wife if the wife is less than 15 years, considered as rape, and he can work in factory like an adult and also along with the fitness certificate. At 16 years, he is considered as a juvenile, and kidnapping if age of a boy less than 16 years without consent, sex with a female below this, all these are considered as rape, kidnapping, and abduction. Then at the age of 18 years, he attains majority. Then he also, a woman can contract a marriage, can go in for a contract of marriage. Then kidnapping at any age is considered unlawful. Then at the age of 18 years, um, he can give a valid will. He he will become a heir to the property, and he can go into service, government service, and he will get the right for vote, and he can give consent to suffer harm, like he can go for surgical operations and all. At the age of 21 years, uh, the girl, if imported into India for intercourse, can be considered as can be dealt with in 366B IPC. Minimum age for marriage is at the age of 21 years for males. Majority under courtship. Offender an offender stays in the Boston school. At the age of 25, he can contest for the parliament or legislative assembly. At the age of 35, for becoming a president, vice president, and a governor. At 58 to 65, this is the age of retirement. So this is just a recap to make you remember. So if you get, as per the x-rays, the age is 17, based on that you have to give the medical legal importance, so you can enumerate all these things. With this, I think we have finished with the age estimation. All the best in your exams. Thank you.